Well, good afternoon. Thank you very much for your time today and welcome to the What's to Gain from Grains webcast. I'm Robin Murray and the Grains and Legumes Nutrition Council is very pleased to be hosting this event, which follows on from the release of our Health Professionals Research Summary Report, What's to Gain from Grains. I hope you will have all received a copy in the mail, and if you haven't, you can download a copy from our website. So today, in What's to Gain from Grains, we have three excellent presentations to share with you, each of them providing you an overview on grain foods and health. So our first presenter today is Dr. David Topping, and David will be presenting on grains and digestive health. David is particularly interested in the development of cereal-based food products which give added value to manufacturers and improve public health. His particular interest is in prevention and management of diet-related diseases such as colorectal cancer. And barley max is an example of this approach. Our second presenter today is well known to all of you, I'm sure, Professor Manny Noakes from the CSIRO. Manny is currently responsible for CSIRO's Food, Nutrition and Health Science program, and she has a strong interest in dietary patterns for weight management, including the role of protein and other dietary factors in appetite regulation. Today, Manny will be sharing with you her thoughts on grains and weight, getting the balance right. And our final presenter today is Dr. Jane Muir. Jane is head of the Translational Nutrition Science at the Central Clinical School, Monash University. Jane's major research focus is in the important role of fermentable carbohydrates in the health of the gastrointestinal tract. She's made a major contribution to the understanding of the role of resistant starch and poorly absorbed short-chain carbohydrates called FODMAPs. So today, Jane's going to help us make sense of gluten-free, wheat-free, and of course FODMAPs. So the program today will take the course of the presentations, but we will also have a panel discussion. So at the conclusion of the presentations, we would like you to have the opportunity to ask some questions. So the panel will join me up here at the front. And for those of you who are viewing on the webcast, if you can please submit your questions and they will be received and we will do our best to answer those in the time that we have available. If we don't cover all of the questions that you've asked, we will be sharing those questions with our panel and be sure to send you an answer to your question. So without any further ado, I will now hand over to David Topping to share his paper, Grains and Digestive Health. Thank you.
Thank you very much, Robin, and thank you for organising this. I'm going to be talking about grains and I've changed it to gastrointestinal health because I think it's a little bit more appropriate. This idea of gastrointestinal health is also known as gut health, and it's basically the optimization of gut function, gastrointestinal function, with the aim of lowering the risk of serious diseases in the long term. So it's both short, medium and long-term effects to improve or enhance the effective working of the gut. Principally, this is aimed at the large bowel. The reason for this is purely practical because the large bowel is the site of most gut disease and most gut dysfunction. But it does actually encompass the whole system. So can grains, well the question is, are grains and grain components linked to gastrointestinal function and health? Well, the bleeding obvious is yes. Prospective cohort studies show a very strong linkage between both whole grains, cereal fibre I should say, dietary fibre, and lowered risk of serious diseases such as colorectal cancer, which is very interesting given that you might have heard that the Treasurer, Wayne Swan, has had colorectal cancer. So this is a very important disease, but there is a linkage showing, or there is an association between whole grains and dietary fibre, cereal fibres, and lowered risk of it. Interventions show relief of simple constipation by fibre-rich foods. No doubt about it in my mind, simple constipation is perhaps the gold standard for the effects of fibre. But not all effects are positive. I'm not going to deal with these today, but there is evidence, particularly from in vitro studies, but also some epidemiological data suggesting that gelatinized starch highly gelatinized starch may increase the risk of caries. And if you think about it, that's not unreasonable, because you hang up wallpaper with starch and it's very, very sticky. So it would be expected to adhere to teeth. And there's also the issue which Jane is going to talk about later, which is gluten and celiac disease, frank celiac disease, which affects perhaps 1% of the population. Well, we used to think about fibre like this. Soluble fibre slows time for food to pass through the upper gut, lowers cholesterol, does all the right things in terms of lowering GI, etc., etc. Sources are oats, barley, vegetable, lentils, beans, fruit, and isolates. And there's insoluble fibre, shortens transit time, helps with laxation, high fibre wheat-based breakfast cereals, brown rice and pasta, wholemeal and rye breads. But it was very simple. It's no longer that simple. And the reason for it being simple was, of course, that it was observational work that gave us much of the ideas in dietary fibre. But things have changed. While population data show associations with improved disease risk for fibre, there are strong experimental data showing plausible mechanisms. But fibre is now much more complex. It's moved beyond the simple soluble, insoluble fibre. Remember that fibre is defined in terms of its indigestibility. So we can't digest it. And if you look at the Fazan's definition, it really revolves around indigestibility in the small intestine, but it's changed to include effects in the gut, in the large bowel particularly, which do not refer solely to indigestibility. So there is total dietary fibre, what would appear on nutrition information panels if we were mandated to put it on. Non-starch polysaccharides. These are, and most of the fibre components are carbohydrates. And they are principally carbohydrates of plant origin, but the non-starch polysaccharides are polysaccharides that aren't starch. And that's a very simple, if you like, splitting of the class, or a simple classification. We can only digest starch, so every other polysaccharide we can't digest. So, for example, if you think of oats, they have the beta-glucans in them. The arabinoxylan's the same. We've got resistant starch, which is the new fibre, even though Jane Muir worked on it years ago. But it's an overnight success, resistant starch. It's taken about 30 years, I think, to get here. And that's the new fibre. And then, of course, we have oligosaccharides, which are the fibre in breast milk. Because the bacteria live on this, so oligosaccharides fit into the classification of dietary fibre, polymerization degrees of greater than 2, and there are oligosaccharides in breast milk. There are also ingredients which are oligosaccharides. And the effects of fibre are now recognized being both physical, in other words, the solubility or insolubility, but also fermentation by the human microbiome. That's the bugs that live inside you.